Okay, we're going to talk about patellar fracture with sleeve avulsion. Patellar fracture is a break in the patella or kneecap, the small bone that sits at the front of your knee. Because the patella acts as a shield for your knee joint, it's vulnerable to fracture if you fall directly onto your knee or hit it against the dashboard in the vehicle collision. A patellar fracture is a serious injury that can make it difficult or even impossible to straighten your knee or walk. And some simple patellar fracture can be treated by wearing a cast or splint until the bone heals. In most patellar fractures, however, the pieces of bones move out of place when the injury occurs.
These are plain x-rays of the knee in a patient with trauma and knee pain. And on the lateral view of the knee, it looks pretty normal. We don't see any evidence of a joint effusion or we don't see any evidence of a fracture. But on the sunrise view of the patella, you can nicely see that there's a comminuted fracture of the patella. So the sunrise views is often used if you're thinking there's injury to the patella because it's really a focused view of the patella. On the lateral view, you're not able to see that fracture.
Okay, patients with patellar slip fractures present without hemarthrosis, the inability to extend the knee and bear weight, and either patella alta inferior slip or patella baja superior slip. This fracture occurs without an antecedent direct blow to the patella. Palpable defects in often present superior or inferior to the patella, with minimal displacement of the fracture. Diagnostic may be difficult as patients may be able to extend their knee without an extension lag with internal rotation of the link and utilization of the extensor fascia lata. Okay, applications in medicine. Epilateral radiograph can be difficult to interpret if the radar does not actually look for a patellar slip, as the bony component of the fracture may be very small. As such, a high index of suspicion must be maintained by the examiner when evaluating patients in this population. Significant patella alta or baja should prompt increasing scrutiny of the radiograph.
Patellar fractures. Basic anatomy. You can see the femur, the tibia, the fibula, and the patella, which we call it the kneecap. The kneecap is attached to the quadriceps tendon at the top and to the patellar tendon at the bottom. Movement of the patella across the knee is normally a gliding, smooth movement. A patellar fracture is an injury to the kneecap. These fractures are commonly caused by a direct blow to the kneecap or from a fall. Patellar fracture types. Transverse fracture. The fracture can be non-displaced or displaced. This is an example of a non-displaced fracture. Displaced fracture. The patella can be pulled apart by the attached thigh muscles. The patient will be unable to do active extension of the knee. Upper or lower pole fracture. The fracture at the site of the attachment of the patellar tendon, as you can see here. Comminuted fracture means multiple pieces. The fracture can be non-displaced or displaced. This fracture type shatters into 3 or more pieces and is very unstable and hard to treat. Vertical fracture. The fracture is non-displaced and stable. The fracture fragment usually stay in place during healing. Osteochondral fracture. A small fracture of the patella, usually associated with acute dislocation of the patella. The osteochondral fractures are usually located in the facet area of the patella. Treatment. example of a transverse patellar fracture. If the fracture is non-displaced or minimally displaced, and the patient is able to do full active extension of the knee,
Okay, the pros. I don't find an advantage in the patellar fracture.
In this video, we'll demonstrate the repair of the broken patella in the knee using a surgical set designed to fix it. The patella is a small floating bone that glides over the femur or thigh bone. It connects the muscles of the thigh to the tibia or the shin bone, helping the knee to move. The cartilage or the eggshell type covering on the underside of the patella and front of the femur allows for smooth motion of the knee. The patella can break due to trauma. First, the surgeon uses a clamp to close the space between the two broken halves of the patella. Then wires are placed to hold the broken bone together. The surgeon then drills through the bones where the wires are placed. And the drilled holes are measured to determine screw length. Then, the correct screws are placed into the drilled holes. And sutures are placed through the screws to make a figure 8 pattern over the patella, holding the bone structure together. This completes the repair of the patella.
Okay, the cons. And the fracture of the patella can actually occur at the top of the kneecap, called the superior pole, or the bottom inferior pole. Most sleep fractures involve the inferior pole. In children who are not fully grown yet, we say they are scaly, immature. The patella is still more cartilage than bone. The softer cartilaginous patella is the scaly immature, and childers more easily than solid. Hardened bone in the scaly mature individual. Sleep fractures were first described in the literature in 1979. Boys are affected 5 times more often than girls. Most are between the age of 8 and 16 years old. Increasing high-intensity sports activity may be one reason this type of injury has started to show up.
This is a presentation on patellar fractures. Patellar fracture occurs when there is a break in the patella, also known as the kneecap. It may occur when a person experiences a high blow to the patella, such as a hard fall or a collision with a hard object. Excessive stresses on the patella for long periods of time may also contribute to a fracture. There are various types of patellar fractures: an undisplaced fracture, which typically does not require surgery. A transverse fracture usually requires surgical treatment if the extensor mechanism is not intact. There are lower or upper pole fractures, multifragmented fractures with or without displacement, vertical fractures, as well as osteochondral fractures. The risk factors for patellar fracture are age, being postmenopausal, participating in high-impact sports such as football, rugby, or soccer, osteoporosis, thin bone or muscle mass, and trauma. Symptoms of a patellar fracture include intense pain in and around the knee, tenderness to palpation of the patella, swelling, pain when moving the knee, and the inability or difficulty to extend or straight raise the leg.
Okay. Okay, issues playing equator. Patellar fracture occur in the pediatric population, typically between 8 and 12 years old. Lateral X-rays demonstrate swelling at the lower pole of the patella and some degree of patellalta. If a small bony fragment has been avulsed with the cartilage, then these two may be seen. Because it is an extra-articular fracture, joint effusion is usually absent. Okay, conclusion. Patellar fractures are rare in the children, and the slip fracture is a particular form of fracture that only occurs in children, where it is the most common patellar fracture. It is caused by rapid muscle contraction. Diagnostic may be difficult, but clinically, on the X-ray, which may look normal, is there is no bony fragmenting.